Good morning, everyone. I loved the commercial, and it really was a spontaneous idea from Jordan that I wholeheartedly encouraged, and it came out fabulously. So I am going to start us off with a story that I think helped me really crystallize what our problem is right now. And this is a true story. Okay, so I, like many of you, I'm sure, are extremely curious about what people are doing in these clinics, not just what they say they're doing, but what's actually happening. And so I went, I'm often mystery shopping, but I do it full disclosure. I'm a physician. I work at Cleveland Clinic Abu Dhabi. I am, also leading a Healthier Living healthcare company. And so I feel like that's the only fair thing to do in these interactions. So I went in, and I had a full checkup through this clinic, and it was, I thought, well done. The physician spent a lot of time with me, asked me a lot of questions. We went through a series of tests. One of those tests was an electrocardiogram, and the nurse took my test 4 times. She printed out 4 ECGs, and I said, okay, we're going to have a conversation now. So the doctor comes in, and he says, very seriously, I think you need to go to the emergency room. And I'm sitting there perfectly healthy and also not having any chest pain, no symptoms. And I just politely said, I understand I have a normal variant on my ECG. Would you feel comfortable if I just talked to my cardiology friend and he gave you the reassurance? Okay, we did that. He was reassured. We went on with our visit. And then I realized I didn't know what kind of doctor he was, right? So at the end of the visit, I just asked him, what kind of training do you have? And he told me he was a urologist, okay? So now, I love urologists, okay? I have many urology friends, but I think they would all agree they're not the first one to raise their hand to read your ECG, right? And they have a role in this kind of medicine. How do you keep us healthy? There's a clear role for urologists, but it's not reading my ECG, right? So I walked out of that visit, and I just thought, we have a problem. We have people who are not qualified to do the things that they're doing. And in addition, we have the testing and the supplements and many things that are just not proven. So why would we lower our standards? Why would we have a different approach to keeping you healthy as we do to when we take care of you being sick? And so, okay, I very clearly had this thought that we need to make a different approach, right? And so what we did in the Institute and what we're really encouraging at this conference is for us to think about how do we make sure that we have what is necessary in order to practice this kind of medicine. Okay, we don't yet have a name for what we're doing. We're keeping people healthy. We're expanding health span. There is a movement to call this precision geromedicine, and we've had many conversations around how do we get people to understand what that is. And the concepts here are, let's put standards in place, and let's think about how is it that we can really think about what happens inside the healthcare system and what happens outside. So we know that this is really what our health system is at the moment, right? We have this tap that is flowing, and it's really just overwhelming, right? We're mopping up the floor, and we really don't have anyone who's turning off that tap. And so part of our goal here is to think about how do we turn off that tap, and how do we empower people with information that's actually accurate that they can use. And so what we have been discussing is, number one, everyone does not do everything. We have to have standards. We've written the first standards with the Department of Health of Abu Dhabi and the Healthy Longevity Medicine Society to try to take a stab at this. We now have standards published by a government that say this is longevity medicine, this isn't longevity medicine, and we used healthy longevity medicine as the name of it at that time, which again is still part of the debate. But what we would love to think about and talk about together is what is it? What are we talking about? How do we make sure that that is, again, at the level of the standards that you would expect when you or your loved one goes to see a rheumatologist or a cardiologist or a general surgeon? And so I think our message here is, why would we lower our standards when everyone's lives depend on them? We actually are trying to help people stay healthy. We should be thinking about all the levels of science and knowledge that we need in order to do that. So I'm going to leave you with this, and we'll pass over to
Eric.
the good Eric.
All right. Thank you, Nicole.